Hi, it's Dr. William. I wanted to talk to you about who is an ideal candidate for having a BBL. So the first thing that you're going to obviously see is you'll see like a very small waist. And you can tell where somebody's waist is just by looking at a photo usually, or examining someone, and I can actually feel where the ribs are. And then you can feel the thickness between the skin and the fat and where the rib is. And so I'll know that once I do the liposuction through that area, we'll be able to reveal her waist. So she has a good waist. And if you have a good waist, probably means you really don't have that much internal fat. Remember, internal fat is always our enemy because I can only work on as the external fat, anything that's outside of your body. And the internal fat, also called visceral fat, is located like around your organs. It's inside of your body. I can see that if we just kind of divide things up, she has quite a bit of fat through this area and right into the upper back. And whenever I do lipo, I always really focus on going high in the back, because the high in the back down through the mid back, that's the start of the Ogee line, and that's the concave part of the Ogee. That's this part here. That's that inside part. It looks like she has a good amount of fat in here, so we're gonna lipo all of that. And then here's something that's really nice, is she's got this kind of glorious deposit of fat here. She's got a small waist, but she's got a heavy love handle that goes down into the key area. Plastic surgeons kind of salivate when we see fatty deposits like this, because we know if we have a small waist and we have a big fatty deposit here, it's going to be a really good dramatic change for the patient. And then if we add in this upper fat lipo, all of this, that will really establish the concave part of the Ogee. Okay, so now when we actually go to the butt, so the transfer part, it's really a two-stage operation. First we do the liposuction, and then we transfer that fat to the butt. In general, she has a really good shape to her butt already. She doesn't have any, she has some nice roundness here. She doesn't have any sign of chicken butt. This is where the chicken butt is, if we see it. But I don't see anything. There's no sign of chicken butt here. She's got some little hollowings here, some little indentations rather, that we can fill in. And she's got a nice, her starting Ogee is pretty good. We just want to really build out her hip more to be able to get this convex part of the Ogee. So now we were working on the concave part when we were talking about the lipo, and now we're talking about this convex part where we're talking about the hips. So the first step that I always do is really just focusing on this Ogee line. And so this Ogee line will come up here. And then the big thing is this lipo here through this key area. That's going to be really good. Combined with removing this flanks, that's going to really help us to get this kind of transition point between the concave part that we're starting in the top and the convex part that we're starting in the bottom. And that little transition area between the two is the key area. And I call it key area because it's so vital to be able to get the butt round. She doesn't have a huge key area here, but she definitely has one. And so I'll lipo through that area to remove that. And then with the fat, she has pretty good volume. In her situation, this is going to be really focusing a lot on the shape. And so we want to lipo through the key area to get that roundness, and then we want to add into the hip to get that fullness there, and then make that whole line just nice and as smooth as possible. What we don't want to see is this kind of stair step in this key area. And I think that's what you get if you don't lipo through the key area. You get a bit of a stair step here. And we don't want that line to be any stair step. We want that line to be as smooth as possible. Now I can't always get it because of the extensibility of the tissue, but we want that line to be smooth. Okay, so here's her after photo. So here's her waist, and now these large deposits that were here were removed. And so we look at how smooth that line is. I mean, it's a really pretty smooth line. And you can see this part here. This is the concave part, and that's set up with the lipo, and then we did that high in the back. You can actually see her incisions, her scars there. She has some acne, so I can't really see her other scars. I know she has one here and here. You can see it was all this high in the back. This is all gone. You can actually see how she's, I don't know if it projects on the video, but she's a little bit hollowed out in here, and that's what happens when you lift your arm up and you raise the scapula. You get a little bit of hollowing in there, and because there's no more fat at all in that area. I think when we start looking at kind of shapes that start earlier, that start really high and then kind of come in, to me, this is a pretty common look. And I'm not saying there's anything wrong with this look, but it's not a look that I personally like. Lots of people like the look, so it's completely fine if you like that look. I'm not being critical of it. It's just the beauty is in the eye of the beholder. That's what everyone likes. And so if her butt kind of came out here and she had really a lot of fat put in that upper part, then I think as if you just look at the line that comes down, then this line starts to come down, and then it really makes an abrupt turn. And I just don't see that happening in nature, where you have that line coming in and then all of a sudden it just like really comes out. I think as soon as you start bending that line is when you start to get away from the natural appearance. I know there certainly are patients that like to go for just, you know, volume, and that's like their number one consideration. It's really, really important for them. But for me, what's the most important thing is to get the shape and to remove all of the fat that I can up high in the back, throughout, lower back, key area, and then add that. And I always add some fat into the legs too. Just depends on how wobbly the Ogee line is in the lower part. She started out here pretty nice and even, so I always put a little bit in, but I didn't really have to put a lot in order to make that line nice and smooth.